Guys, warm welcome to our channel, The Medical Tutor. If you are visiting our channel for the very first time, please do subscribe and support our channel by liking and commenting in this video. Today, we are going to study the most important essay question. So, we are going to study about coma today. Uh, we are going to see about the definition of coma, mechanism of coma, causes of coma, and examination, investigation, management, and also we are going to discuss about the Glasgow coma scale. Now I am going to teach you the coma from the Manipal Manual of Medicine. So let's discuss the definition of coma first. Coma is a clinical state in which the patient is unresponsive to the external stimulation and is unarousable, which means that for any kinds of external stimulation, the patient will not respond. Also, the patient will not arise from the unresponsive state, so which is said as unarousable. So, mechanism of coma. So, mechanism of coma. Actually, consciousness is maintained by the interaction of reticular activating system of the brainstem and the cerebral cortex. So, any pathology in the brainstem, cerebral cortex, and reticular formation will result in coma. This is about the mechanism of coma. Let's see the causes of coma. Causes of coma is actually divided into two. We are going to see the causes of coma under two topics. One is brain dysfunction, diffuse brain dysfunction, and the other one is brainstem dysfunction. In diffuse brain dysfunction, drug overdose is one of the cause of coma. Overdose of sedatives, anesthetic agents, and alcohol results in coma. Metabolic conditions like hypoglycemia and hyperglycemia causes coma. Hyperglycemia is in hyperglycemic conditions, diabetic ketoacidosis and all will result in coma. And hypoxic or ischemic brain injury, hypertensive encephalopathy, uremia. Hypertensive encephalopathy is nothing but it is a rare but life-threatening emergency condition that occurs when the blood pressure is extremely high. So when the blood pressure is extremely high, it causes brain dysfunction, and that is hypertensive encephalopathy. Uremia is nothing but abnormally high levels of waste product in the blood, which is mainly urea and creatinine. Also, hepatic failure, respiratory failure, electrolyte imbalances like hyperglycemia, hypocalcemia, hypernatremia produces results in coma. Endocrine causes like hypoadrenalism, hypopituitarism, hypothyroidism causes coma. Metabolic acidosis, hypothermia, hyperpyrexia, trauma following the head injury, epilepsy, infections like meningitis, encephalitis, cerebral malaria, sepsis also causes coma, subarachnoid hemorrhage, cerebral edema, and carbon monoxide poisoning. As we all know, carbon monoxide has high affinity to the RBC than the oxygen. So, this carbon monoxide poisoning also results in coma. Brainstem dysfunction, which results in coma, are brainstem hemorrhage or infarction, brainstem neoplasms, that is tumors like glioma, brainstem demyelination, Wernicke-Korsakoff syndrome, trauma, and pressure effect on brainstem like hemisphere tumor, infarction, abscess, hematoma, and cerebellar mass lesions. Examination of the patient with coma is divided into immediate assessment, vital signs, then general examination, neurological examination, cardiac examination, abdominal examination, and respiratory system examination. So, in immediate assessment, we have to take care of airway, breathing, and circulation, ABCs first. If the airway, breathing, and circulation is not are not all right, then we have to correct it first. Then get a quick short history from the attenders of the patient. We should ask about the previous health of the patient, history of diabetes, head injury, history of convulsions, history of alcohol or drug abuse, any prior episode of coma or attempted suicide. Also, we should ask about history of vomiting and headache before the loss of consciousness. It is to rule out the intracranial hemorrhage. If there is a history of vomiting and headache followed by loss of consciousness, it suggests intracranial hemorrhage. Also, we should ask about the diabetes, epilepsy, and hypoadrenalism. Then we should check for vitals, which is nothing but temperature, heart rate, respiratory rate, and blood pressure. If there is increase in temperature, that is fever, it indicates systemic infection. For example, it may be pneumonia, bacterial meningitis, or viral encephalitis. Bradycardia. This is a term which is used to refer the reduced pulse rate. So, bradycardia suggests ingestion of medications like tricyclic antidepressants or anticonvulsants. Then marked hypertension. If the blood pressure is high, it is marked hypertension is observed in patients with cerebral hemorrhage and in hypertensive encephalopathy. If the BP is low, hypotension suggests alcohol or barbiturate intoxication, internal hemorrhage, myocardial infarction, and septicemia or Addison's disease. In case of brainstem problem and bilateral cerebral dysfunction, Chinese Stokes respiration is seen, which is periodic respiration is seen. In case of diabetic ketoacidosis and uremia, Kussmaul's respiration is seen, which is acidotic respiration. Then general examination. Many general examination findings will provide a clue to find out the cause of coma. So, if there is pallor, marked pallor actually indicates the internal hemorrhage. Then cyanosis. Coma may be due to respiratory failure or cardiac failure. Then, if the skin is cherry red in color, it suggests carbon monoxide poisoning, because only in carbon monoxide poisoning cherry red color skin is seen. So, carbon monoxide poisoning will be the cause of coma in case of cherry red skin. If there is the presence of jaundice, that is yellowish discoloration of skin, eyes, and all, in such cases, coma may be due to liver failures and sepsis. Petechia and purpura. In that conditions, coma may be due to intracranial bleeding or due to some bleeding problem. Hyperpigmentation is seen in Addison's disease. Injection marks. If the injection marks are seen while general examination, coma may be due to drug abuse. Coarse and dry skin suggests hypothyroidism. Excessive sweating suggests hypoglycemia or shock. Macular hemorrhagic rash is present, then possibility of meningococcal infection. It indicates the possibility of meningococcal infection, streptococcal endocarditis. We should also look for the order of breath. Uh, Look for the smells of ketone, alcohol, or ammonia. If multiple bruises are seen, if multiple bruises, bleeding, CSF leakage from the ear or nose, or periorbital hemorrhage is seen, it suggests the possibility of head trauma. It suggests the possibility of head trauma. Then let's see about neurological examination in coma. In case of comatose patient, only limited neurological examination can be done. So we'll first see the posture of the limb and body, presence or absence of the spontaneous movement on one side, position of the head, position of the eyes, then head, neck, and spine. We'll note the trauma in case of head and neck, and we'll also note the neck stiffness. We'll check for the pupil. We'll examine the fundus. And ocular movements. We'll examine the abnormalities of the conjugate gaze. Also, we have to look for the asymmetry in the tone and reflexes and plantar responses. Let's discuss about the cardiac examination. Cardiac examination is done to rule out the diseases like atrial fibrillation, to find out the cause of cardiac causes like atrial fibrillation, infective endocarditis, and myocardial infarction. These atrial fibrillation, infective endocarditis, and myocardial infarction can produce embolic stroke and further result in coma. In case of abdominal examination, we have to look for the abnormal bowel sounds, organomegaly, that is enlargement of the any organs like splenomegaly or hepatomegaly, and any presence of mass in the abdomen, and ascites, fluid collection. If the vowel sounds are absent, it indicates acute abdominal conditions and anticholinergic poisoning. Increased bowel sounds are seen in OPC poisoning. And hepatomegaly is seen in hepatoma or metastatic disease. In case of respiratory system examination, we have to look for the evidence of COPD, chronic obstructive pulmonary disease, pneumonia, or any other lung disease, which can produce respiratory failure and coma. Then investigations. Investigations done in comatose patients are routine biochemistry like urea, creatinine, electrolytes, glucose, calcium, and liver function tests. Simply renal function tests and liver function tests. uh, we should also check for the hormone levels like TSH, thyroid stimulating hormone levels, serum cortisol, then blood culture and malaria test to rule out cerebral malaria and sepsis. We should screen for the drugs in the blood like diazepam, narcotics, urine examination for ketone bodies, atrial blood gas analysis to rule out hypoxia, atrial blood gas analysis to rule out hypoxia and hypercarbia. Then imaging 11, in case of imaging, we will do CT or MRI brain. CSF examination should also be done to rule out meningitis and subarachnoid hemorrhage. EEG is also done, electroencephalography. Management of the coma patient is divided into two: specific treatment and general measures. In case of specific treatment, underlying cause of the coma should be found out, and underlying cause of coma should be treated. In general measures, we have to place Riles tube and urinary catheter. Then skin care should be given. Like frequently, we should turn the patient out to avoid bed sores or pressure sores, and the patient should be kept preferably in the water bed. Oral hygiene should be maintained by using mouthwashes and frequent suction. Eye care should be taken care of like by tapping of lids, prevention of corneal damage by applying the lubricating eye drops and eye ointments. Nutrition and hydration by food and water may be given through the Riles tube. IV fluid may also be used if required. Now let's discuss about the Glasgow Coma Scale. Glasgow Coma Scale, it is actually used to assess the consciousness of the patient, conscious level of the patient. Okay, so to assess the level of consciousness, we use Glasgow Coma Scale. By using this Glasgow Coma Scale, we'll be able to grade the severity of the coma. In case of acute brain injury due to head trauma, intracranial hemorrhage, and many other causes, we'll use this Glasgow Coma Scale. Initially, Glasgow Coma Scale tells us about the severity of the brain dysfunction. While assessing it serially, like serial assessment of the Glasgow Coma Scale after the initial assessment demonstrates the evolution of the injury. Actually, three parameters are used in the Glasgow Coma Scale. For remembering that, we can use the mnemonic EVM. Remember, electronic voting machine. Remember in that way. So, E refers to eye response, and V refers to verbal response, and M refers to motor response. Okay. Uh, Actually, the Glasgow Coma Scale is scored between 3 and 15. 3 is the worst one and 15 is the best one. If the score is 13 or higher, it tells us that there is mild brain injury. If the score is 9 to 12, it indicates moderate injury, and if the score is 8 or less, it represents severe injury. Remember, if it is above 13 or above, it indicates mild brain injury. 9 to 12 indicates moderate brain injury, and a score of 8 or less represents severe brain injury. I'm actually teaching this coma question in the aspect of writing the exam. So, if the coma is asked, if the coma question is asked in case of essays or like that, we have to write compulsorily about the Glasgow Coma Scale. So while writing Glasgow Coma Scale, we have to mention about this box. So first we are going to see about the eye response. So we'll score based on the eye opening, like from 1 to 4. If there is no eye opening, we'll give a score of 1. If there is eye opening to the pain or pressure, a score of 2 is given. If the eye opening is done to sound, a score of 3 is given. And if the patient spontaneously opens his or her eyes, a score of 4 is given. Then for verbal, then we'll score based on the verbal response. If there is no verbal response, we'll give a score of 1. Incomprehensible sounds, if the patient gives incomprehensible sounds rather than words, score of 2 is used. If the patient says inappropriate words, a score of 3 is given. Then motor response. If there is no motor response, a score of 1 is given. For example, if the patient is asked to raise his hand, if the patient doesn't respond, so a score of 1 is given. And extension to the pain, a score of 2 is given. And flexion to the pain, a score of 3 is used. And withdrawal response to pain, a score of 4 is given. And localizing response to the pain, a score of 5 is given. And if the patient obeys the commands, then the score of 6 is given. We have to actually add up these scores, and the cumulative of the score indicates the brain injury. We saw like a mild, moderate and severe brain injury. No, in that case we are using the cumulative score. If the cumulative score is 13 or higher, it indicates mild brain injury. The score is 9 to 12, that is cumulative score is 9 to 12, it indicates moderate injury. And if the cumulative score is 8 or less, it represents severe brain injury. That's all about coma question. So if you're writing the coma question for about 15 or 10 marks, you have to write in this order. Like first you have to write the definition, mechanism of coma, causes of coma, and examination aspects like general examination, vitals, then neurological examination, abdomen examination, cardiovascular and respiratory system examinations, then investigations that has to be done, management, and then Glasgow Coma Scale. That's all. If you like this video, please do subscribe and do like and comment in this video. Let's see in another video. Please do share it with your friends who are reading for MBBS University examination. Thank you.